Morning everyone, Dr. Eric, your fitness physician and peptide doc, and hope everyone is having a great day. Just finished a workout and a little sauna session. I like to talk about recovery. I'd like to answer some questions. I had some clients and patients ask me a few questions about a few different things I wanted to address. One was obviously one of the big topics now is things like NAD therapy and things of this nature. So I know someone was asking me about this, and I think it's a great therapy that can be used, but as with everything, there's an art to it, and you have to do it very specifically. And some people can benefit from it, but other people are not in that physiologic state where they would benefit. In other words, similar to some peptide therapies, such as CGC and ipamorelin and things of this nature, some people are actually have too many senescent cells. I'm going to write a little blog post about that, but we'll talk about it in another video about senescent cells. But those are the cells that are not those cells that stop working properly. Instead of dying, your body killing them off, they linger around kind of like zombies. They call them like the zombie cells, right? So, and then they secrete these pro-inflammatory cytokines and enzymes and peptides and things of this nature that can wreak havoc on your other cells. These are linked to inflammation and inflammaging, etc. These are one of the inflammation, and of course these senescent cells are very highly linked to inflammatory diseases, autoimmune disease, and many of the diseases of what we call of aging, in diabetes, insulin resistance, obesity, hypertension, etc. So we want to eliminate these cells as much as possible, get our cells functioning. That's what I'm all about, is improving health and fitness at the cellular level, treating the cause of things, not just covering them up. So we have to get the cell functioning again properly, get the mitochondria functioning, get all those processes turned on, reduce that inflammation. So if someone's overly inflamed, they have some metabolic abnormalities, they're fatigued, their hormones are out of whack, etc. We have to correct all that first. If you give someone NAD or one of these peptides or anything without correcting this, they're actually going to get worse, and you're going to feel like crap, and they're going to not like you very much. So we have to correct those things first. And once again, that's the art of medicine. That's why you have to tweak and treat these people individually. There's no simple protocols. There's a lot of non-medical people out there, giving these little protocols, and they'll take this dose on this day and stop it. But they've not actually seen patients. They're not a physician. They're not a clinician. There's an art to it, and you can't just go out willy-nilly. It's not a cookbook. You just give this and give that. It's not that simple. Same with fitness. There's pros out there who work with people and work on their body mechanics. It's not as simple as throwing weight around. You have to look at their body mechanics, their structure, their lifestyle, everything else. So there's more to it than that. So the bottom line is, yes, NAD can be useful, but it's useful in only certain times. It's not something you do all the time, all year round. Very select cycles that you can do it on, and again, you have to correct the inflammation, correct the metabolic issues first. For example, once someone is tuned up and they're good, maybe do some NAD subcutaneously or intravenously for several weeks. I do that a couple of times a year. Some of the oral supplements like NMN and NR can be useful, but we're finding that it's much higher doses are indicated and needed to really have a beneficial effect. There's some other things that we could do to make your cells function appropriately without even taking NAD, and you're enabling your body to make its own NAD. Again, by doing some of these protocols, some of these peptide protocols, we found that we can actually stimulate our body's own production of NAD. You don't even need to take these. So a lot of things to it. So I just wanted to address that real quick, and everyone have a great day. Talk to you soon. Bye.